News Check is a program that is earmarked to ensure that we keep you afloat with what is happening, or the news-shaping headlines at this hour in real time. And also we have a candid interview on a topical issue and also the state of the nation. Speaking about a topical issue, on the first hour we'll be discussing telemedicine. What exactly is it? We are now in a global village. How can we assist all other Kenyans? And also the telemedicine prosper in the country now that we are transiting from the NHIF to also the SHIF, or the Social Health Insurance Fund. My name is Njue. Anne Wangeshi is my colleague on the bottom right of your screen. On the second hour, we'll be talking about the state of the nation. A number of things have happened in the last more or less 1 week. We're also keeping tabs with what is going to be happening at Parliament. Remember, after the budget was read last week on Thursday, today is the finance bill that is going to be presented by the Finance Committee at Parliament, so that the members can have a feel and also debate on that bill. Remember that the voting will be on Thursday, but a lot is happening before Thursday and also today. Looking at State House as we speak, the Kenya Kwanza are having their PGM, the parliamentary group meeting with the head of state, more or less to canvass the contents of the bill and also to put their house in order. We will be bringing you a comprehensive report on what has transpired in Parliament before we cross over to what has transpired at State House before we go to Parliament at about 2:30. Much is said. Let's first of all delve into the first topic of discussion, where we are looking at telemedicine in the country. And joining me on set is a medical doctor, Dr. Cecilia Macharia. Karibu sana, Doc.
Thank you. Thank you very much.
That was a very vague introduction. Kindly, a formal one now.
All right, thank you. My name is Dr. Cecilia Macharia. I am in general practice. Studied in Western Uganda and have practiced in Kenya over the last more than 10 years now. And currently in the telemedicine space, where I find that we are addressing a need that is there. And it's a need of accessibility of care, quality care. And working with a company called Healthx Africa. And Healthx Africa is actually a registered virtual medicine company, level 2. And we offer services to the people where they need it, where they are at, leveraging on technology, and we are able to have a complete consultation, you know, just as we do, a complete conversation virtually, consultation virtually. And we go ahead and using different forms of technology. So we can have videos, we can have chats, we can have calls with the patient. And we know that most of the diagnosis, because this is where people have a question. How are you able to diagnose just by talking to someone who you're not seeing?
Maybe you can start that by telling us what is telemedicine and how it benefits the patient and also the healthcare provider.
All right. So telemedicine is where a medical practitioner is leveraging on technology to offer medical services to the patient who's at the end of that call. And I will bring in a small difference in telehealth, because now telehealth, we're adding all the other important medical services. For example, insurance, we'll have webinars for doctors, we'll have continuous medical education. So all that can, when we add all that up, we get telehealth. But now telemedicine is the doctor and the patient, and we're using technology. Its advantages is that we are able to reach more people. So it is accessible to many people. Yes, how is it accessible?
Yes.
Because, like I said previously, we're using video calls, we're using chats, we're using normal phone calls. So you just need to have a phone. And when you have a phone, you can reach a doctor. And how are we able to make this diagnosis? But 80% of our diagnosis actually comes from the medical history. So when you call me, there are questions I will ask that will guide me towards what is your problem, what is the diagnosis, and be able to help you. So how am I helping you? Maybe it is by giving you a prescription. or it is by some lab tests that need to be done, or probably it is actually by giving you some medical advice or referring you to another specialized doctor, because in general practice, we see everybody. So at Healthx, we have registered medical practitioners who are at the end of that call when you make it. Another way we are accessible is video calls. So for those who have the smartphones, you call and you find a doctor at the end, and it's almost like a physical consultation, only that we are not at the same time and place, okay? The other thing is that in terms of accessibility, let's think about how much it costs for you to go to the hospital. There is a transport cost. That transport cost comes with money and it comes with time. There is traffic to go through. Yeah. Now we can settle all that just by a phone call. You can call in your home. It is private, it is secure. You're not feeling anxious about who's looking at you and whatever conversation you're having with the doctor. So that's another advantage to the patient. The other advantage is that the care that you're getting is efficient in terms of, think about your typical consultation. We've been there, and you'll see the patient. They took time waiting to see you. So they're waiting in queue to see you. Then they have seen you, you finished your consultation, and you send them to the lab. They join another queue, and then they have the lab test done. There's a waiting time or turnaround time for the test results, and then come back to you, and you write a prescription, back to the pharmacy, another queue. So when we think about the time it is taking, actually telemedicine is saving on time. And we know time is a resource that really once lost, it's gone. So we're saving on that as well.
Other than time, how does it differ from conventional face-to-face appointments that we've had previously?
All right. The difference is profound in that, as we said, there is the improved patient and doctor conversation. Why is it improved? Sometimes you may come to see me and there's some things you're not very free to talk about. Now let's put a screen. When we put a screen, or even remove the screen, it's a phone call. It's easier to communicate some things. If you're talking about issues of mental health, you find that many people, and I'll just say that and bring a gender issue here, men do not easily want to access mental issues, mental consultations, But on the phone, they will easily speak, air out their grievances. They will speak out whatever is the problem. And so we find that we're really able to help people in their need at that time. Let us talk about sexual issues. People will freely talk about them on the phone, different from face-to-face. Yes. So in that aspect, yes, telemedicine is making a great stride in helping people at their time of need. However, I must add, it cannot replace physical consultations. And there are times when you receive that call, and when you listened to the patient, you're sure this one needs an examination, this one needs something more. I need to see this patient physically to be able to give them quality care. So are we compromising on quality? No. There is no compromise in quality in telemedicine because we are able to assess. Is this a patient I will be able to complete the conversation now or the consultation, or is this a patient that I need to refer for a more detailed examination? And so we find that actually we are not working against the physical, we are actually working with, So it's actually enriching the quality of care that the patient is getting.
What are some of the common uses of telemedicine in healthcare, and especially here in Kenya? Because COVID-19 showed us that we can do a lot using technology, and especially in health.
Yes. So right now we find that, let me take you back, because telemedicine is new when we are consulting with the patient, but doctor to doctor, it has been there. It has been there a long time. And you'll find that most health practitioners will pick up that phone and call another colleague, consulting about a patient that's before them, or referring or planning something. So how is it working with us now? The first thing is, in mental health, we have seen a large uptick of the services in mental health. So we're talking about counseling. We're talking about these patients who just need a debrief, you know. They've been through a difficult time, and you need to talk about this so that you can be able to move on, face tomorrow, you know, and not feel like the world is crashing in on you, though there are those moments. So in mental health, there's a big stride. Let's talk about nutrition, you know. And you think about this patient who has been told, oh, uko na shida ya sukari. You know, and suddenly this patient has to start, it's like a whole life changeover, lifestyle modification. And so here is the patient who needs nutritional advice. And they're given this advice, but you go home and you're like, was I told to eat beans or to eat more red meat? And you're unsure. Just pick up your phone and have a nutritionist consultation. You see, it's bridging that gap of you must have this appointment, you must, you know, like that. Then let's talk about chronic diseases like diabetes and hypertension. And people today, they are advanced, you know, smartphones, smartwatches, and all these devices that we're using. And actually, we have an app. You can be able to link, you know, just go onto your app, link it to your device, take your reading, and in real time, the doctor is able to see your reading. So we are able to give you some advice at that time. We are able to caution you. We are able to remind you, did you take your medication today? Your numbers don't look so good. And follow up on appointments. If there are any tests that need to be done, this can be done. It's actually something that is bridging a gap in terms of the follow-up for the chronic disease patients.
Yeah. And what exactly is the technology typically used for telemedicine? And imagine now, it's my first time.
Yes.
How do I even begin? Where do I get the doctors? How do we start the doctor-patient conversation?
Yes. All right. So I will just walk you through what we have done, because it is best when I speak about what we have done. So at Healthx, you will call us. I already mentioned there's an app. So when you download the app, healthxafrica.com, you just go to the website, download the app, key in your information. Important to know about that app is that the information that you have, because that's something else that people would be worried about, is the safety of your information. And so your information is protected. And so you're able to, first, using the app, you have your information with you. So if you go to any doctor, they can see this has been the trend of your blood pressures. This has been the trend of your blood sugars. This is the medication that you have been. On this particular day, you saw Dr. X, you know, who gave you this medication, because all that is available on the app. So that's the first thing that you can do. But then, and so think of this person in the village. How will they reach Healthx? Now, you do not need a smartphone. We have a toll-free number. So there's even no cost to the patient. 0800-720-795. You call that number, and the first person who receives that call is a care coordinator. Now, this person is going to walk you through what information do we need. Just as the other hospital, when you go, you fill in a data form. You know, what's your name? How old are you? Same kind of thing. And then you will be read a privacy policy, because you need to understand how safe is your information, when do we share it, can we share it or not, and then you agree. Once you agree, then you're transferred to a doctor.
And talking about information, the medical history and all this, this is more or less the doctor-patient confidentiality is not compromised when we use telemedicine?
No, it is not compromised, because first, your information, even when we send, I did not complete the loop. I should have completed. So when we send you information, it comes password protected. So we are also using SMSs, we are also using emails to send and share that information with you. It is password protected, which means you're the only one who has access to your information. And if your information is breached, you gave away the password. You see? So that's the first thing. On our end, we have a team that is ensuring, because we know that there are breaches in security, even banks are suffering from that. But we have a team that is ensuring, they are round the clock ensuring that they are able to deal with these breaches, if any, you know, able to, you know, counter it before it happens. really, yes.
And I remember a couple of months back, the head of state did commission a batch of healthcare providers who are going to be working hand in hand with the health facilities that we have in the country. And how can we also infuse this technology? Because these are the people who go to the mashinani completely, as opposed to how we see hospitals and health facilities mostly in the country. Many are in marketplaces, many are in big towns.
Yes.
These are the people who are going to the ground that we talk about, the ground, wako kwa ground.
Yes.
How can we infuse telemedicine to actually help them do their work?
All right, I'll actually talk about something that we are doing in Western Kenya in one of our project areas, and we are actually able to work with them. Now we are using the phone. You see, the mashinani we are talking about, now we're using the phone. And what happens is when they access the patient, then the patient calls and is able to speak to the doctors. So you see, that quality question that we had, we are able to address it. Now, the question you have asked addresses one of the barriers to telemedicine. We understand it is technology, and most people will hold it at an arm's length. You know, they are worried about how does this really work. We're used to daktari anione, you know. This is daktari nasikia. You see, it's on the phone. I'm just listening to the doctor. The doctor is hearing me. So there's a barrier in perception, a barrier in accepting the change from the normal, what we can call the normal way we have done things. And with the community health promoters who are on the ground, if they are able first themselves to accept, like in our project area, accept that, and then be able to be the link with the telemedicine space, we are actually all of us winning, because the patients are able to access the healthcare practitioner they need at that time of need. Yes.
And now, looking at, it's a new field in the country.
Yes.
How many doctors have embraced this? And the same thing, how many Kenyans are embracing this? Because Kenyans would like to see a doctor. I would like to see a doctor and go to a hospital and do everything there. But this is a field that can be even more convenient for me seeking any medical assistance.
Yes. So in terms of doctors, like we said, at Healthx, you have doctors who are employed on full-time basis. So it's not doctor log in and see the patient, no. Doctors show up at the office and attend to the patients who will call in. That's the first thing. So it shows you that there is an acceptance to that. We are not working alone, because general practitioners cannot work in isolation. We have referral systems, and we find that our patients, when we refer them, they're accepted well, which means that our colleagues are accepting and acknowledging the existence of this mode of seeing patients, and they are able to carry on with the care of the patients that we have referred. Now, another thing is that for the patients, you've asked about Kenyans, are they accepting? When we began 3 years ago, okay, we began with 0, but we've been able to impact 15,000 lives in Kenya today. You see? So the numbers don't lie. There is acceptance. Not only individuals, we are talking about corporates, institutions, schools, different people. And another way that this is moving in speed and an impact, a positive impact in health, is in wellness. You see, you're at the office here and people just come, collect your samples, then I give you a call and discuss your results. You see, you're not unwell, but whatever information you're able to get confirms your status of health at that time. So across the board, there is an uptick, and like I mentioned, in mental health, great increase in that. More people are really signing up. Even in the general consultations, in nutrition, we're seeing an increase in the number of consultations, which means people are learning and accepting, and also the value of time, you see. Once, at first you started, you're skeptical, but then when it works, you're like, oh, wait a minute, I did not have to go and spend half a day at a physical hospital and be told, no, just go and change this diet. You did not even come out with a prescription. You got diet advice. You got medical advice. You need to change your carpet, you know, for example, if your children have got some allergies or something like that. you find that you have saved on time. Yes.
And how do institutions and healthcare providers, institutions like yours, and healthcare providers, doctors, clinical officers, ensure that we do not compromise on the quality of the healthcare of people who seek treatment using telemedicine?
Yes. So first, before you see the patient, you are a qualified medical practitioner. So you are governed by your various training, ethics that you must follow. So if I receive a call from a patient, and remember, these calls come from anyone, because it is not that we're only treating colds and flus and skin rashes. No, anybody can call. And when they call, they are able to get care from a qualified professional who is going to guide them through and be able to understand, no, if you have told me this, you need to go for a physical evaluation. If you have mentioned this, we can, now I go ahead and give you the advice that you need, probably send you a prescription if you need one. Yes. So in that way, we are safeguarding the quality of care. Yes.
Let's now discuss the challenges or limitations of telemedicine. The first one is the uptake, because most people would prefer to see a face-to-face doctor as opposed to just having a call with somebody who cannot see.
Yes. Very good. And that challenge was actually addressed by COVID, because much as we wanted to go to the hospitals, we now could not. We were advised not to go. And so this is where telemedicine really got an acceleration. And people got a little bit comfortable. But the challenge remains, it is not all conditions that can be treated via telemedicine. And so there is a knowledge gap there, because there's someone who will call and they are expecting to complete the consultation on telemedicine, but you say, no, we have done this much. Going on forward from here, you need a specialist consultation, you need a physical evaluation. So that's one of the challenges. Another challenge is technology. We're using technology, so there is a gap there. So if you have network challenges, we have encountered those sometimes. If you have no internet, because how it works is this way. If you call me, I want to just talk a bit about the tools that we use in telemedicine. So if you call, it could be just a normal call. So with a normal call, I would inquire, do you have an email address? Okay, so you have a skin rash, could you send me a photo? You see how now the loop goes? So if you send me a photo and I find, okay, I've been able to assess what it is, and then I can send you a prescription back to your same email. Now imagine the person who doesn't have that. There is a gap, all right? However, in dealing with some of those gaps, in some centers, we have what we call a virtual clinic. So a virtual clinic is a hybrid kind of technology and physical. So we have both. So the clinic itself is manned by a medical practitioner. And then on the other end of that screen is the doctor. So this could be a nurse, it could be anyone else with some medical training background. And then on the other end, we have the doctor. So when the patient comes and they are speaking with the doctor, there's privacy, so the nurse is not there. But if I need anything extra done, the nurse will come and do it. You see, that hybrid solves the problem for those who feel, no, I need to see the doctor physically. So you're almost there, you have seen the doctor, but there's someone actually with you doing, maybe you just need a sugar test. It's a really fast thing to be done, and it can be done at that point. And so we are closing that loop. In terms of medication, can be delivered to your house. You see, you're calling from your house or the office, and we have decided we want to give you, you've sent your picture, on email, and so now we want to send you a prescription or send you medication. It will be delivered to you. Another way is in terms of lab tests. We have partners who will actually come and collect the sample from your house, wherever you are. And then once the sample is collected, it is processed, it is sent to me. I am the one who requested.
I remember when we started this conversation, it's a little bit cheaper to use telemedicine in some
Yes.
aspects.
Yes.
Now, doesn't this make it a little bit more expensive if you have to have somebody come take my lab tests, and that somebody has to go with them, finish up on what, and then I have to get the drugs? I think it's better if I come to the hospital on that occasion.
All right. Let us still talk about the cost.
Okay.
All right? Because the delivery is coming at no charge to you.
Oh, okay.
The sample collection is not at any charge to you. And if you're to pay any price, it is the cost of the service you would have paid even in the hospital. So if it was a lab test, you would have paid for the lab test anyway. And so it is that same cost is the same cost that you're going to pay even when they come and collect the sample at your home or office or wherever it is.
Let's get this information out. I believe one of the best things to do when you're introducing something or you want something to sink, and especially in developing countries, you create awareness.
Yes.
And this is one avenue that we are having here, where we can tell Kenyans, hey, there's this, so we can try this, which maybe could be more convenient and even sometimes more cheaper than the conventional face-to-face going to the doctors. And actually, Kenya, you don't have enough doctors. We've seen even some getting work abroad.
Yes.
How do we ensure that this information goes out there? People to know there's an establishment like yours which gives these services. Like now, for example, I'm a journalist and I know this is a field, but I don't quite know it well, and that is why we're having this conversation.
Yes.
How do we get this message out there?
All right. So this is one of the very this is one of the good platforms, you know, to get this message out. And for anyone who's listening to me, if you have even just for medical advice, because when you talk about primary health care, this is the first care you get before we are referred to any specialized care, first thing. And secondly, we are actually helping or part of the universal health coverage program, in the sense that you are now able to access medical services at your home where you are. So it is a doctor for every Kenyan. You said it. There are not enough doctors, but here we are saying a doctor for every Kenyan. How do you access this? I will talk about Healthx. 0800-720-795. That is the number to call. It is toll free. If you have your smartphone, just go Healthx app, download it, and get all the information. It is available there. Give us a call. You will get more information.
And do you believe the Ministry of Health should be also trying to sensitize people in regards to this? Because this would save a lot of money also.
Yes, yes. Definitely it is multi-sectorial, you know, from the regulation, so the medical council, we are registered, we are licensed. That's the first thing. So when you're getting your care, you need to be sure that it's from a licensed practitioner or practice. And then, yes, from the government, we need everything. And there's one other area that you've not mentioned, because we are using technology, so the issue of global village comes in. So what do we do? And that is one area where, again, we would require the multi-sectorial approach, because across the borders, I'm licensed to practice in Kenya. So if you call me from outside Kenya, the most I could do is give you medical advice. I cannot issue a prescription. I cannot request lab tests. No, I cannot, not with the current way we are working. We are limited.
The current framework.
The current framework, we are limited, yes. But let us talk about Kenya, because we want to increase accessibility to everybody. And so we are saying that, yes, even for your parents in the village, and there is a concern, just call. You see, when you call me and I tell you, no, you need to go to hospital, you will go faster because you're more confident that Daktari amesema, you know.
Just different. So the doctor ordered.
Yes, different from when you're thinking, should I go, should I not go? And what I'm speaking of actually constitutes to delays in healthcare. Just because you were not sure you needed to go at that point when that happened, you know. But when you picked up a phone and called, then you're able, or chat, you know, chat. Go to the app and you can chat with us. Yes.
And still on that, technology, still on technology. Does the Mulika Mwizi guys count as well?
Yes,
because you might want a photo of maybe a rash that I have, and also the level of literacy
Yes.
Because let's be very honest, not all Kenyans have high literacy levels.
Yes.
And you might be requesting some things that somebody who is 70 or 80 years old may not be able to give you.
Yes.
How do you work around that challenge?
All right. So thank you for that question, because it's again one of the challenges of telemedicine and one that we have actually encountered. However, remember, 80% of what your problem is, I get it from your story. You see? So it is how I ask the questions, how you answer me in that conversation. Remember now the barrier of the patient-doctor relationship has been broken, and so you're speaking freely. I am able to identify. Where I feel that beyond this I am not able to identify, at that point, yes.
And where have you seen, because you've been in operation for a couple of years, right?
Yes.
Where do you see the highest uptake of telemedicine? Because I'm quite sure you've made a survey to see where your patients are.
Most is in the urban areas. Yes. Much
How
as
then do
we
you cascade it to mashinani?
Very good question. Because, you know, the word of mouth moves fast.
Yes.
So I will speak about what we have experienced at our place of work. So someone calls, they're in Nairobi. And when we finish the consultation, and they will say, oh, this is nice. Can I link my mom in the village as well? Okay. There you have it, you see? So when you have experienced the service, you have seen the quality of care, you're able to spread it to the other people who actually need it. Yes.
The framework that we have, yes, we have a number of challenges in regards to the framework. And now we are transiting from the NHIF to the Social Health Insurance Fund. Actually, the Social Health Authority will be having a media briefing, and if they happen to do that, in this show we'll be crossing over to see how they have lined up for NHIF to transit to the SHIF, Social Health Insurance Fund. And one of the aspects is that this is something that also needs to be included in the framework, because the 2,500 community health promoters, it's a good step. Actually, it's the step in the right direction. But how do we ensure that we also inculcate or infuse telemedicine into the Social Health Insurance Fund?
Yes, in terms, I think that one, the best way to do it would be in terms of looking at it from a cost perspective, you see. So you equip the community health promoters, and they know they can use telemedicine. You create awareness on the availability of telemedical services in the country. There are many, not only our company, there are several. So equip people to know that they can access the telemedicine services. Remember, we already counted the cost. And in fact, if we also look at the cost of consultation via telemedicine against the physical, it is way low compared to a physical consultation. And so you find that most people would take that up, and it is not everybody who goes to the outpatient department or to the emergency room who needs to be there at that time, you know. So we are also decongesting the health facilities so that we have more time for those who really need to be there. And remember, the doctors are also not enough. So you're helping in that way of the human resource for health. The personnel are able to now offer more patient-centered services to the patients who are there without feeling the strain of, I have a long queue that I have to get through. Yes.
And have you ever had an incident where a customer starts out very well and then pulls out in the middle of the telemedicine, maybe after a couple of appointments or something, or some of the challenges that you have had to endure as a health provider specializing in telemedicine?
Yes, those instances do happen, because again, remember, we are limited in terms of geographical location. So we have had a consultation that has happened, you book an appointment, next week the person is out of the country, you know. So while you try to follow them up, they're like, okay, I'll talk to you when I get back. So that challenge does exist. There are actually patients who we advise to go for the physical consultations, because their care would not be comprehensive if we continued in the telemedicine way. So there are those patients, but then we do follow up on them, you see. So much as you have gone and maybe you needed surgery and it's been done, so we'll call you up. How are you doing? you know. Yes, because there is still room in terms of health awareness, increasing the knowledge, you know, just that health, promotive health care, so, and preventive. That information is so important, and you don't really need to be physically present for someone to tell you you're taking a bit too much sugar if you're putting 4 spoons in your tea. You see, a phone call would do that, or someone telling you, no, you've been sitting around too long, you need to do some exercise, and that's 30 minutes a day. That's over the phone, you know. Yeah, so there is still value over and beyond the doctor's consultation, and that value can be done via telemedicine. And interesting to note, even other hospitals are using the hybrid. You know, you see your patient physically, follow them up using telemedicine. So it is something that's actually going on, and it should be encouraged.
Health is devolved in the country, and I've seen some counties a little bit ahead than others when it comes to telemedicine. Have you thought of maybe cascading it into other counties other than Nairobi?
We have actually worked with 37 counties now.
Okay.
Our presence in terms of the patients we have been able to reach, that 15,000 number is 37 counties. And apart from that, we actually have worked with some county hospitals and had that virtual clinic there with good good feedback. Yes.
How do you see telemedicine evolving in the future? Because you've been in the market for a couple of years.
Yes.
And if we look at developed countries, this is something that they started out way before us. Just that COVID made us understand that we really need to go this route.
Yes.
Yeah.
So it is something that we need to do. We must do. If we are going to absorb even the health personnel that are available, if we are going to offer quality care to every Kenyan, a doctor for every Kenyan, we will have to do it the telemedicine way. Because we must admit, it is not everyone who will be able to move from their homes to the health facilities for various reasons. Socioeconomic reasons top the list, you see. But if they are able to at least just have a phone, remember it's toll-free, you're calling us toll-free, so all you need is a phone that has some charge, you know, and then you can speak to a doctor. So telemedicine is really where we need to go. The world is evolving, let us not be left behind. And by telemedicine and accepting and being part of the network, because we don't want to lose anyone along the way. So we need to have these collaborations across the board, from all levels of the healthcare practitioners, the legal frameworks, the regulations, everyone just come on board and let us have a way where we can work this and embrace it. We are embracing it for the good of the common mwananchi, for the good of everybody who needs healthcare. And now, you know, when we have insurance, we feel comfortable. Insurance is also on board on telemedicine. But apart from that, think of the time when you need the care, or it is your relative who has no access, because this is one of the disparity, no access to medical care because of financial issues. And you are in Nairobi and you're talking to someone in your village, you know? Just think about how helpful telemedicine would be at that point in time. I've gone too far. Think about a mother who left her 3-year-old in the house well this morning, gets to work, has endured all the traffic, got into the office, and at around 10:15, the house help, the nanny calls and tells her the baby is just vomiting. Think about the stress of this mother at work, thinking, I go back all the way home, pick my child and go to hospital. Now think of the solution with telemedicine. Give us a call. We have a 3-way connection with your nanny in the house. You have a healthcare practitioner who's there with you at that same time, dealing with your problem. As you see, when you're doing that, you could be on the way, but there's already a solution.
Okay.
You see the difference?
Well, it's like a first aid.
Yeah, there is something that's going on. So it's not just the nanny anxious with a baby who's not feeding. And she's now very concerned. And here is an anxious mother in the office trying to beat traffic to get back home.
Yeah.
Yes.
And because you've been in the industry for a while, which are some of your biggest clients? Those with chronic diseases, those with ailments, like those needing nutritional advice.
All right.
Who's the biggest clientele?
Okay, so let me answer it this way. The people who have embraced the services are many across the board. And you see, you use the services when you need them. So from corporates, from schools, from other organizations, hotels, we have a wide range of clientele. Now, who use our services? We find mental health topping the list. Yes, and like we said, there is always that reluctance to actually tell someone I'm sad on most days, you know, and for fear of being told, deal with your issues, you know, they're able to actually access the care that they need. Then we have the consultations. Yes, people call
general consultations.
General consultations, just as
and
they would.
Do you charge for those?
Yes, our services are on a subscription basis. Yes.
Let's go to the cost.
Okay.
Everywhere there's a tech boom, of course there can be a cost.
Yes.
Are you telling me that using your services to be far much easier for me, and even the cost itself, than going to a conventional hospital?
All right. I will indulge you.
Okay.
So for a monthly subscription, 795. You have limitless consultations, day and night. We work 24 hours a day, 7 days a week. So you can call your doctor anytime. On top of that, you can speak to a psychologist. You can speak to a nutritionist. 795 for 30 days. If we do 3 months, it's 995.
995 for 3 months?
Yes. If you do it for a year, it's 29.95.
So we're talking about me together with my family, because maybe my daughter or my son will be having an issue and I have to call you. Is that a new subscription, or it was just under me, they are covered like the way we do insurance?
No, that's individual.
That's individual.
Yes, family packages is different depending on how many members.
How much is it for a year, roughly?
For a family? For a family for a year is 8,000.
8,000.
Family of 4. Yes.
Does
Again,
that involve,
remember,
if I have to get some samples, will you come and get them for that amount, or I still have to chip in?
You will pay for the price of the lab test. Yes.
Despite the fact that you'll have to get your lab technicians to come over to my house.
Yes.
And because we are running out of time,
yes,
I would like you to tell Kenyans why they should also, in as much as we want to go and see the doctor, why they should also think about it, or also maybe beef up your health and your families by using telemedicine, and especially in cases of emergencies.
Yes. So one thing that is very important, in cases of emergencies, I have to set this very clear. All you will get is medical advice, because we are not able to offer emergency services on the phone. But for your general consultations, please feel free to call us. Feel free to use your phone. It's a very good way of using your phone. Yes, to access health services for your family at any time, any place, day or night, okay? Because that is when you find emergencies or trouble happens anytime. Please just use your phone and reach out to us. That medical advice you're going to get will be helpful. That for your parents who have chronic disease, and you know, sometimes we have experienced this. The parents are on medication, they need to come back for follow-up, they're not able to make their follow-up, they skip medicines, they run out on their drugs. Give us a call for that refill of that prescription. We are not working against the consultants, we are actually working with them for the better health of the patient. That is important. So we're working together as a team. We're not working against each other. And so we are helping the overall health and well-being of the family, not just individuals, but of the family, by making healthcare accessible.
Final question, how do we integrate telemedicine into our healthcare systems? And you know them very well, being a doctor in the country. Effectively, how do we integrate telemedicine in our healthcare systems effectively as we wrap up?
I think the first thing is acceptance. Are we courageous enough to challenge what we have accepted as normal? Do we have that confidence that if I give the doctor a call because I have a headache, I will still get the same quality of care as when I went for a physical consultation? Let us challenge that. You see, that comes from within, because we must be the change that we want to see. Then secondly, when we have challenged it, and this is both across the board, so from the healthcare practitioners, from the regulators, and even the patients themselves, we'll start finding that we have a way. It's already there, the licensed institutions offering virtual services, but then what we want is more uptake. You know, we have 15,000, let's make it 15 million, why not? You know, let us get more people accessing this care. It's going to improve on the quality of care, it's going to improve on the people getting the care when they need it. You know, that doctor for every Kenyan, when you need it, when you need that service, yes. And another thing is just having the legislation and the regulations in place. There is work going on, a lot of work in progress. And like I said, telemedicine, borderless, but our regulations are within the borders. So those are conversations that are still ongoing.
Dr. Cecilia Macharia from Healthx, where she has been helping us to unravel the telemedicine, how it works, what are some of the merits and demerits, and some of the challenges they are facing here in the telemedicine world. And one thing is that COVID showed us is that we can also better our health care provision using technology. Check them out. Maybe it might be of help. But well, that's where we put a cap on this first hour discussion. We've been looking at how we can bridge the gaps in the healthcare system by use of telemedicine. Thank you, Dr. Macharia.
Thank you.
And away from that, in the next hour, we're taking a quick break, but when we come back, we'll be looking at a number of things in the country. We're talking about the state of the nation. And today, it's good to note that CJ, that is Chief Justice Martha Koome, will be leading judicial officers and also the country in mourning the death of Principal Magistrate Kivuti, who was fatally shot in court last week. And other than that, the UDA, call them the Kenya Kwanza, are having their PGM meeting at State House. Other than that, the finance bill today will be a big day. MPs on the spot as we take the finance bill to Parliament for it to be debated before a final vote is taken on the same. We'll be back with that discussion in a bit.